My name is Lisa Baldwin, and I'm from Black Mountain, North Carolina. My family's case involves judicial and government corruption as well as healthcare fraud. Our difficulties began with trying to obtain local healthcare access for our son, who is diagnosed with chronic fatigue syndrome and severe dysautonomia. Our problems began after two physicians who had been my son's previous primary care providers for the past 6 years terminated his medical care and then later joined together into a medical practice partnership with a local hospital system. Our case involves medical records that were altered, records that were lost, and medical tests that were fabricated. I believe that our case is unique because it's 100% provable as to healthcare issues because all medical appointments were audio taped by me for the past 7 years for my protection. So it becomes very easy to prove the false allegations against me and my family when those allegations never occurred and our audio tapes tell the true story. Because our story went from lack of medical care access to our son being taken and placed in DSS custody for 10 months, based solely on malicious reports by physicians who fabricated stories, we feel that our story must be disclosed to help other parents and their children who might face a similar fate. Most of all, you would never think that healthcare professionals can dream up a story like this and bring harm to a patient. A travesty that would cause us to lose parental custody, not to be able to see or talk to our medically disabled son for 5 months, and for both parents to be falsely accused of Munchausen syndrome by proxy. But it happened, and we can prove who was involved and possibly their motives. We want an investigation done, and we want the people who falsely imprisoned our son and who tortured him daily, both physically and emotionally, and also the people who further damaged his heart to be held accountable. Professionals who told us on tape to play the game if we ever wanted to see our son again. Our son was told that if he asked for his wheelchairs, he may never see his parents again. Our son was even told, it was a medical experiment gone bad. Surely North Carolina should offer greater disability protections for their disabled citizens. Our son was declared disabled since 2004, however, he received no monetary benefits until 2009 due to our income disqualifying him. As the social worker testified in court, I quote from the transcript, Social worker Galloway, Buncombe County Department of Social Services caseworker, testified that in her multiple visits to the respondent parent's home and observations of the minor child, never did she witness anything that suggested abuse or neglect on the part of the respondent parents towards the minor child. Further, she testified that as far as she knew, the department petition was based solely on the report of Dr. Molly Burkoff. Social worker Galloway also admitted under oath that the medical reports sent to Dr. Molly Burkoff, who is the UNC medical reviewer, were incomplete. No answer was offered by social worker Galloway as to the satisfaction of this court as to why only portions of the child's medical report was sent to Dr. Burkoff, or who in the department made such a decision to offer only selected portions of the report. No answer satisfactory to this court was offered by social worker Galloway as to why, especially in the light of the fact that the department later claimed that the child was in such dire straits under the care of the respondent parents that it took almost 1.5 years after receiving the allegation against the parents that the department finally petitioned for custody. Of great concern and worthy of further investigation, social worker Galloway testified that it was only after the child began to receive Social Security disability benefits that the department petitioned for custody of the minor child. And then only days after obtaining custody of the minor child, the department intercepted the child's benefits. Finally, the court finds that social worker Galloway utilized disingenuous methods unbecoming of any state employee or state agency to lure the respondent parents into the department office in order to serve them with this petition. Court finds that these dishonest methods and the individuals within the department responsible for their implementation shall be basis for further investigation. You can find stories like mine at lawlessamerica.com.